After 2 years of on-again and off-again interruption to our lives, 2 years of living frequently under public health restrictions to protect our hospitals from COVID-19, after 2 years of on and off masks, of limiting our social circles, of working from home, of those plexiglass barriers, of all of it, after 2 years of kids having to bear too often the weight of a global pandemic, 2 years of extraordinary government intervention in our lives, and let's face it, 2 years of too frequently division in families and communities. After all of that, friends, we have to be honest, it has been 2 tough years. We have finally turned a major corner on COVID-19. All of the data, both here in Alberta and right across the world, says that the worst of COVID is behind us. And that this disease that has changed our lives in so many ways is no longer an open-ended threat to our lives and livelihoods from all that we know today. And that is why, as of midnight last night, Alberta has lifted basically all of the remaining public health restrictions that were in place. We have ended the provincial mask mandate. We have removed all capacity limits for venues. We have ended restrictions on interactive activities, on liquor service, and on operating hours for bars and restaurants, plus other hospitality venues. So we've also removed all social gathering limits. We've lifted remaining school requirements, and we've ended health screening before youth activities, which was the only remaining measure applied to kids and teenagers. We've also ended the mandatory work from home order, and I think that's great news for downtown cores across Alberta, but especially the 2 big cities, as thousands of workers will come back to their offices starting today to breathe new life into streets that have been empty for too long. Something Albertans do not deserve right now is uncertainty and confusion. And that is why I'm announcing today that Alberta's government will introduce into the legislature as soon as possible amendments to the Municipal Government Act, which will remove the ability of municipalities to impose their own separate public health restrictions. But now that we're moving out of this, we think it's really important that we do so united, not divided, with clarity and not confusion. We're concerned that if we have a patchwork of different policies across the province, it will create unnecessary division and confusion amongst the public. One critical thing for public health measures to be effective is that they be as clear as possible and consistent as possible. And we've done that imperfectly, I admit, through COVID, but having municipalities improvise their own policies when it's not really their area of primary responsibility is, I think, unhelpful and divisive. And finally, there is no compelling public health rationale for it. And I am concerned that if municipalities have this power, it will increasingly become a political and not a public health issue, which I think will just generate public cynicism. So we appreciate the care and concern of people in municipal government about these issues, and we're always willing to listen to their views about public health policy. But we think as we go into this phase, getting our lives back to normal, it's important that there be unity and clarity, consistency, and that's what we're bringing in through these amendments. In terms of mask mandates, look, for the government to force people to wear a mask is, I think we've almost become used to these things as though it's normal. This is an extraordinary intervention in people's lives. It makes a lot of people very uncomfortable. And let me say, as I said earlier, yes, there may be some marginal advantage in reducing viral transmission, but we know that Omicron is so transmissible that it is all around us, and we have to be realistic about that. We also, look, at the end of the day, we've always said that public health restrictions in Alberta will only be there as long as they are absolutely necessary to prevent overloading our hospitals. They should not be there for 1 day longer. The government should not exercise extraordinary powers on people's basic freedoms and their normal life unless there is a very compelling and immediate need to do so, in this case, to protect our hospitals. That is no longer the case. And finally, we see growing non-compliance, and it becomes increasingly difficult for businesses, for example, to enforce something when the risk, both personal and social risk, is so much lower. And as I'm just going to restate a final argument about this, which is that, as I said, we are social beings. We are made to live together, to interact with each other, seeing each other. And this kind of constant kind of interruption in normal social interaction, I don't think is healthy in terms of people's mental health and emotional well-being. We should be at least as concerned about the mental and emotional well-being of people now as we are about COVID, given the declining pressure on our hospitals. Well, we have given direction to AHS to come to us with options on the vaccine mandate because the data is clear that while vaccines are still powerfully protective against severe outcomes like hospitalization and death, there is now no longer any meaningful statistical difference in terms of transmission and infection between vaccinated and unvaccinated individuals. And that's why we lifted the restriction exemption program 3 weeks ago. Particularly in the spring, summer, and fall of 2021, we saw vaccines having a very powerful effect at reducing transmission and infection, not just severe outcomes. But that has changed. And our approach to the disease has to change as the disease changes. We can't just be bloody-minded about this when a policy lever that we pulled is no longer useful. So with the waning protection of vaccines that have been taken months ago and the much higher level of transmissibility of Omicron, we now no longer have a statistically significant difference in the chances of transmission between the vaccinated and the unvaccinated. So for folks who continue to be concerned, look, if there are people who are very elderly or who are uniquely immunocompromised, yes, they do need to take care. And that's why, for example, we're maintaining the mask requirements in nursing homes and hospitals, of course. But I would just send a broader message that it is not good for individual health or social health to live permanently in a state of fear. And I send this message to those who have been, for 2 years, promoting a constant, nonstop message of fear. Yes, there have been times when we have legitimately been afraid of running out of hospital beds, and where action was necessary. But to promote a constant psychological background noise in our society of an elevated fear for a disease that is now less severe with widespread population protection is irrational, and I think will only accelerate the mental health crisis we see in our society today.